Hey friends, welcome back to the channel in another video. My name is Dr. Caroline, a practicing board-certified family medicine physician, and this channel is created to help primary care physicians maximize productivity and scale their income without overworking or risk falling into burnout. If that type of content sounds interesting to you, then definitely make sure to subscribe. In today's video, I want to share and discuss an article or post that I came across on LinkedIn. It's titled RVU-based Physician Contracting by Nicholas Wyatt. Now, I'm not going through the entire article, just a very small section that I'll be highlighting for the purpose of this video, but if you want to read the entire article, then I'll have the link below in the description box. So you all know by now that I practice in an RVU based system. RVU stands for relative value unit, if you didn't already know. Now if you want to get some basic information about RVUs and how that translates into revenue, I do have some videos in my channel that you can definitely check out. But just briefly, RVUs are a metric used to measure provider productivity and ultimately determine compensation. And the RVU model is a widely used compensation model in the healthcare system. By the way, if you're interested in learning the practical strategies to maximize productivity and scale your income, this is exactly what we teach in our RVU consulting program, so check out the link below if you'd like to learn more. From this LinkedIn article that I mentioned, and like I said, it's a very small section that I'm going through for the purpose of this video, and this section essentially breaks down the average annual work RVUs for different medical specialties. So this is the article here, again titled RVU-based Physician Contracting by Nicholas Wyatt. Like I said, if you want to go through the entire article, the link is below in the description box, but like I said, the section I want to share in this video is this one right here, which breaks down those average annual RVUs for different medical specialties. And so as you can see here, we have primary care specialties, so IM, family medicine, peds, that falls around 4,000 to 5,000 RVUs per year. General surgery, which is around 6,000 to 8,000. Emergency medicine, between 5,000 to 7,000. Cardiology, 6,000 to 8,000. Radiology, 8,000 to 10,000. We've got anesthesiology, neurology, and psychiatry there as well. So again, primary care falls in that 4,000 to 5,000 RVUs per year, which is kind of depressing when you think about how much work a primary care physician does day in and day out. This just doesn't sound nearly enough. Now, it is just an average, so do keep that in mind. Now, I bring this up because when I started out as a new attending, I was told that most primary care physicians on average are generating between 400 to 500 work RVUs per month. So if we take, let's say, 450 per month, that equates to about 5,400 work RVUs annually. And so as I was building my patient panel and my work RVUs were slowly trending up, I eventually reached this sought after average. So I was like, cool, I'm at the level where other primary care physicians are, so I must be doing pretty good. But I had no clue back then that there were the elites. Now I know there's not actually a name for this, but I call them the elites. There are quite a lot of primary care physicians that are scaling their work RVUs literally to the moon. I mean, they are generating 7,000, 8,000, 9,000, 10,000 plus annual work RVUs. Like what? As a primary care physician. And these numbers essentially mean that these physicians are earning quite a top tier income. I mean, as you can see here, you mainly see these kind of numbers in the specialist categories, but primary care can achieve these numbers as well? What? How? These are the questions that I used to ask myself. Here I thought I'd reached where I should be as a primary care physician, but I was just average. And nothing wrong with being average, but I definitely became curious as to how these other primary care physicians were able to generate such a high level of annual work RVUs. I used to think to myself that there must be something that they know or something that they're doing that I'm clearly not, and several other primary care physicians probably aren't either. So I was curious to learn. And this is around the time when I was working on recovering from burnout and trying to learn how to maximize my compensation. This is the time when I started implementing practical strategies that I had taught myself to maximize productivity and my income. And over time, these strategies worked. My productivity scaled and so did my income. So I wanted to create this quick video just to inspire you and share with you that you don't have to just be average. And again, nothing wrong with being average. And I know not every primary care doctor wants to maximize their productivity or scale their income or earn a top tier income, and that's fine. But if you are one of those primary care doctors that does, then I hope that this video will inspire you to reach that goal. And you can reach your compensation goals by practicing efficiently, providing great care to your patients, providing profitable services to your patients, getting really good at billing and coding, and keeping a steady, not necessarily high, volume of patients. And these are some of the core strategies that I used myself to reach my goal. And as you can see, there's nothing fancy or special about these strategies. You're not creating a new system. You simply have to learn and master the basics of RVU production and dial them up where you see fit in order to reach your goals. Alright friends, I hope this video was interesting to you. If you'd like to see more content like this, then definitely consider subscribing, because I do post a video like this every single week, doing my best to help primary care physicians maximize productivity and scale their income without overworking or risk falling into burnout. Again, if you're interested in joining our RVU consulting program and learn the practical strategies to maximize productivity and scale your income, then definitely check out the link below. Also check out the free training video that I've linked below as well. Thank you so much for watching. Make sure to leave a like and share this video with your colleagues. I'll see you next time.